Welcome to This Week in Ophthalmology. This week we're covering 9 notable papers spanning advances in retina, new evidence in cornea and anterior segment care, and insights into myopia and ophthalmic research methods. Let's dive in. We begin this week in medical retina with a cautionary tale about long-term follow-up. Publishing in the BMJ, investigators report the 3- and 4-year results of the STAR trial, which evaluated stereotactic radiotherapy for neovascular age-related macular degeneration. You may recall the 2-year results suggested that a single 16-gray dose of radiotherapy could reduce the anti-VEGF injection burden. However, this extended follow-up, which returned patients to routine care while maintaining masking, effectively reverses that conclusion. Over 4 years, the radiotherapy group did receive slightly fewer injections, a mean of 19 compared to 22 in the sham group. But this came at a significant cost. Visual acuity was 8.3 letters worse in the radiotherapy group. Furthermore, reading center-detected microvascular abnormalities were far more common in treated eyes, occurring in 58% of the radiotherapy group versus just 16% of the sham group. The authors conclude that these long-term vision outcomes no longer support the use of stereotactic radiotherapy for neovascular AMD. While one treatment modality proves disappointing, another strategy for reducing treatment burden in retinal vascular disease shows promise. A real-world study in the British Journal of Ophthalmology evaluated outcomes after switching patients with retinal vein occlusion to off-label aflibercept 8 mg. The study included 156 eyes with either branch or central RVO that had already received at least 10 prior anti-VEGF injections. After switching, the mean treatment interval gain was 1.6 weeks over 12 months. Critically, the proportion of eyes needing treatment every 6 weeks or less dropped from nearly 38% down to 18%, while the proportion on intervals of 9 weeks or longer increased from 38% to over 60%. This durability gain was achieved without any compromise in visual acuity, which remained stable. The findings suggest that for heavily pretreated RVO patients, switching to high-dose aflibercept can meaningfully extend treatment intervals. Rounding out our retina section is an intriguing cohort analysis from the journal Retina, exploring a potential systemic protective effect for diabetic retinopathy. Using a large, real-world database, investigators compared diabetic patients with pulmonary arterial hypertension who were treated with prostacyclin analogs to a matched control group on other therapies. Over a 5-year period, patients receiving prostacyclin analogs had a significantly lower incidence of developing non-proliferative diabetic retinopathy, with a hazard ratio of 0.59. They also had a lower risk of the composite outcome, diabetes with ophthalmic complications. While no significant difference was seen for proliferative disease, the data suggests these agents may have a microvascular protective effect that warrants further prospective investigation. Turning to the anterior segment, a systematic review and meta-analysis in cornea provides a definitive answer for treating fusarium keratitis. The analysis pooled data from 11 randomized controlled trials involving over 1,800 participants. The results establish a clear therapeutic hierarchy, with topical natamycin 5% emerging as the standard of care. Compared to topical voriconazole 1%, natamycin was associated with significantly better visual acuity, corresponding to an improvement of approximately 2 Snellen lines. It also substantially reduced the risk of corneal perforation and the need for therapeutic penetrating keratoplasty, with the odds ratio being 0.42. The authors found that adjunctive systemic or intrastromal voriconazole did not offer consistent benefit and was linked to more adverse events. This meta-analysis provides strong, high-level evidence to guide clinical practice. Staying with the cornea, a trial, or DSO, in Fuchs' endothelial corneal dystrophy. This Phase 2 randomized trial evaluated topical ripasudil, a Rho kinase inhibitor, administered for 12 weeks after DSO. The results were striking. The group receiving ripasudil 4 times daily had a significantly higher central endothelial cell density at 12 weeks compared to placebo, 531 cells per square millimeter versus just 228. Corneal edema resolved in 81% of the ripasudil group by 12 weeks, compared to only 9% of the placebo group. Consequently, The need for rescue therapy with subsequent keratoplasty was much lower in the treatment arm, at 9.5% versus 27.3% in the placebo group. The medication was well tolerated, suggesting that topical ripisudo can significantly improve DSO outcomes, potentially broadening its application. Finally, a study also in cornea provides quantitative October evidence on a common clinical challenge: wound healing after cataract surgery in diabetic patients. Comparing 51 diabetic eyes to 90 non-diabetic eyes, the study found that at 1 week post-op, diabetic eyes had slower epithelial healing, greater corneal edema, and significantly more structural defects, including internal gape, endothelial misalignment, and descemet membrane detachment. The risk of these defects was higher in older diabetic patients and those with higher preoperative intraocular pressure. This provides an evidence-based foundation for counseling diabetic patients and suggests a need for closer postoperative monitoring, particularly in those with additional risk factors. Our final section covers myopia, genetics, and research methodology. From the British Journal of Ophthalmology, a real-world study asks if switching between different types of myopia control spectacles can enhance effectiveness. Investigators compared over 250 children who switched spectacle types to a matched cohort of over 750 who did not. They found that the children who were switched had a significantly faster rate of myopia progression before the change. After switching, their progression rate slowed, narrowing the gap with the control group. However, this benefit was not sustained, as progression accelerated again with prolonged use of the new spectacles. The takeaway is that for children showing a suboptimal response, switching spectacle types may provide a temporary boost in efficacy, but this effect appears to wane over time. In Basic Science, a paper in the American Journal of Ophthalmology reports on a large-scale search for new genes that cause Usher syndrome. Using data from the International Mouse Phenotyping Consortium, researchers screened over 9,000 single-gene knockout mouse lines for concurrent retinopathy and hearing abnormalities. This massive effort identified 18 novel candidate genes. While this is early-stage discovery in an animal model, these genes now warrant further investigation to determine if they cause vision and hearing loss in human patients, potentially opening new avenues for genetic diagnosis and therapy. Lastly, a study in ophthalmology highlights a crucial point for anyone interpreting research from large population biobanks. Using the UK Biobank, researchers compared how different definitions of glaucoma affect associations with known risk factors. They found that a definition requiring both a diagnosis and evidence of treatment, like medication or surgery, yielded substantially stronger odds ratios for risk factors, like high intraocular pressure and thin retinal nerve fiber layers compared to a definition based on diagnosis alone. For instance, the odds ratio for high IOP was 23.6 in the diagnosed and treated group versus only 11.4 in the diagnosed-only group. This demonstrates that case definition is critical in biobank studies and that more stringent, treatment-based definitions provide a cleaner signal for identifying risk associations. If you only have time for one paper this week, make it the meta-analysis on fusarium keratitis in cornea. It provides a clear, evidence-based answer to a frequent and challenging clinical problem, definitively establishing topical natamycin as the first-line standard of care over voriconazole. Here are the key takeaways from this week in ophthalmology. First, the 4-year results of the STAR trial show that stereotactic radiotherapy for neovascular AMD leads to worse visual outcomes compared to sham treatment, and its use is no longer supported. Second, for fusarium keratitis, a large meta-analysis establishes topical natamycin as the standard of care, showing it is superior to topical voriconazole for improving vision and reducing corneal perforations. Third, for patients with fused dystrophy undergoing descemet stripping only, adding topical ripisudo 4 times daily significantly improves endothelial cell density, speeds edema resolution, and reduces the need for subsequent keratoplasty. Fourth, for heavily treated patients with retinal vein occlusion, switching to high-dose aflibercept can successfully extend treatment intervals without compromising visual acuity. And finally, for children with a suboptimal response to myopia control spectacles, switching to a different type of lens may offer a temporary improvement in efficacy, though this benefit may fade over time. That's your roundup for This Week in Ophthalmology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.